ebigambire Dr. Ruth Acheng wabire narambura Amarwariro omurubuganda.
We want to thank God that so far we have only had 2 waves, and the second wave was quite devastating for us as a country. There are many other requirements to make it function as a fully fledged health center for. Part of it is the human resource. Health center force are under the local government, and it is their duty to ensure that they recruit the requisite staff. It is not the duty of Ministry of Health. And that is why I charged the cow with the responsibility to ensure that staff are available and to have a hospital in every district. And obviously a regional referral hospital serving a population of 2 million people. And this has already been in progress, and government will ensure that the health center falls equate to a community hospital with all the services that is required for the people as a first point of a facility that can offer surgical services.
Mu gihangwa gandi abanyamakuru bashabura kwatansagiye nabe by'amagara babana bahandika amakuru agakwatiye n'indwara z'ebigwererezi hezero na COVID-19 okushabo kwirweyo uw'abanyamakuru abaho mu district ya Kigegwa babire no bashongorwa akuba kubasa kwera abantu mu kwerinda indwara nkezi.